Hi, I'm Shelain Patel. I'm a consultant orthopaedic surgeon and I specialise in foot and ankle disorders. So it was a choice between either becoming an architect or becoming a doctor. And in that sense, when you're young and idealistic, it's a case of saying, okay, what do I want to do in life? And the option to make people better was much more appealing than building nice buildings. Well, in medical school, medical students rotate through lots of different specialties. And I went into orthopedics suddenly realizing that there was this amazing specialty where it was very practical, very hands-on, and unlike other medical specialties, it wasn't concerned about prolonging life, but much more it was about making the life that you do have better, trying to get people more functional, trying to get them out of pain. And for me, that was the moment that I thought orthopedics is the specialty for me. Um, so the things that I find most rewarding are probably the simple things like seeing patients stand and walk without pain for the first time in years. Um, it can also be things like when the patients tell me that they finally understand their condition and their prognosis, not really having understood what was going on with their bodies. And I'm also very fortunate that I kind of work with lots of good colleagues, and then we're able to work in a team together to make sure that the patient's outcomes are kind of optimized and we can do the very best for them. So the thing that I value, I think my patients value most about me is my honesty. I'm generally very upfront with my patients. I tell them what I think and I don't try and sugarcoat it. So what that means is that when they're going through a treatment plan, they know exactly what to expect, when things can happen, what problems might arise. And when they know all of these things in advance, then it makes them much more prepared for what's going to happen in the future. And the flip side is of what I value from my patients is I need them to understand that treatment's a two-way deal. And that means that I'll put my very best into treating them, but at the same time, I kind of need them to put their very best into getting the best outcome. So simple things like saying they need to elevate their leg or they need to stop smoking. If they can do these things, then it kind of makes me confident that their outcome is going to be as good as it can possibly be. I think patience is probably the number one thing to be aware of whenever you're undertaking any surgery, and that means patience during the operation. So for me, that means remaining calm, collected, and having a plan in place, and knowing that the operation will progress at whatever speed it needs to make sure that the outcome is what's going to be achieved. And from the patient's viewpoint, after any operation or after any treatment, is about knowing that things don't get better straight away. There is no condition where there's an instant fix, and there's going to be a period of recovery. And being patient and knowing what to expect is going to be hugely important in making sure that a year down the line, or whenever it might be, that their outcome will take some time to get better.